Hey guys, please watch my video till end because the quality content which I will provide you in or less than 3 minutes will be priceless and very useful to you. It might change your life, so I don't think you will skip my video. So let's start the powerful video. The accumulation of an excessive amount of fat in the liver might result in inflammation, which can make the condition more difficult to manage. Alterations to your nutritional habits and physical activity routine might be able to help reverse the disease. Before starting the video, please do not forget to like, share, subscribe, and press the bell icon for new interesting videos. There is another name for fatty liver, which is hepatic steatosis. It occurs when there is an accumulation of fat in the liver. Although it is acceptable to have a modest amount of fat in your liver, having an excessive quantity of fat might become a health risk. The liver is the second largest organ in your body after the lymph nodes. It assists in the processing of nutrients that are derived from food and beverages, and it filters out hazardous compounds that are present in your blood. When you have an excessive amount of fat in your liver, it can lead to inflammation, which in turn can cause damage to your liver and lead to scarring. This scarring can, in extreme circumstances, result in the failure of the liver. Alcoholic fatty liver disease, AFLD, is the medical term for the condition that occurs when a person consumes a significant amount of alcohol and develops a fatty liver. It is referred to as non-alcoholic fatty liver disease, NAFLD, when it occurs in individuals who do not consume a significant amount of alcohol. What signs and symptoms characterize a fatty liver? The progression of fatty liver can occur in 4 stages, including the following. A simple fatty liver is characterized by an accumulation of overabundant fat in the liver. In most cases, simple fatty liver disease is not dangerous if it does not advance. Inflammation of the liver is present in patients with steatohepatitis, in addition to the presence of excess fat. Recurrent inflammation in the liver has now resulted in scarring, which is a symptom of fibrosis. Despite this, the liver is still capable of functioning correctly in most cases. Cirrhosis is characterized by widespread scarring of the liver, which is detrimental to the liver's capacity to perform its functions. It is impossible to reverse this stage, which is the most severe one. The manifestations of AFLD and NAFLD are comparable. Nevertheless, there are many instances in which fatty liver does not generate any visible symptoms. On the other hand, you can have feelings of fatigue, discomfort, or pain in the upper right sector of your abdominal region. Some individuals who have fatty liver disease go on to have problems, one of which is scarring of the liver. The scarring of the liver is referred to as liver fibrosis. When severe liver fibrosis develops, the disease is referred to as cirrhosis. Cirrhosis is a potentially life-threatening condition that can lead to liver failure. The damage to the liver that is caused by cirrhosis is irreversible. As a result, it is of the utmost significance to take measures to forestall its development in the first place. Cirrhosis can create symptoms such as the following: abdominal discomfort, a decrease in appetite, a lack of strength or tiredness and weight loss, nauseous, dry, itchy skin, eyes and skin that are yellow, prone to bruising or bleeding easily, urine that is dark in color, feces that are pale, fluid accumulation in the belly, ascites, swelling of the legs, edema, web-like clusters of blood vessels under the skin, breast enlargement in men, and confusion are all symptoms of a number of medical conditions. With regard to the various forms of fatty liver disease, the non-alcoholic and alcoholic forms of fatty liver disease are the 2 primary categories of this condition. Fatty liver disease can also occur during pregnancy. However, this is a rather rare occurrence. Fat liver disease that is not caused by alcohol, NAFLD. A condition known as non-alcoholic fatty liver disease, NAFLD, occurs when fat accumulates in the liver of individuals who do not use a significant amount of alcohol. You may be given a diagnosis of non-alcoholic fatty liver disease, NAFLD, if you have extra fat in your liver and you do not have a history of drinking excessive amounts of alcohol. A condition is referred to as simple non-alcoholic fatty liver disease, NAFLD, if there is no inflammation or associated consequences. NASH, which stands for non-alcoholic steatohepatitis, is a subtype of NAFLD. It occurs when inflammation is present in conjunction with the accumulation of extra fat in the liver. A diagnosis of NASH may be made by a physician if the amount of fat in your liver is excessive, your liver is inflamed, and you have no history of drinking excessive amounts of alcohol. It is possible for NASH to lead to liver fibrosis if it is not addressed. It is possible for this condition to proceed to cirrhosis and liver failure in extreme situations. AFLD stands for alcohol-related fatty liver disease. Consuming a large amount of alcohol is harmful to the liver. Alcoholic fatty liver disease, often known as AFLD, is the initial stage of liver disease that is caused by alcohol consumption. The condition is referred to as simple alcoholic fatty liver if there is no inflammation or other consequences associated with it. There is a subtype of AFLD known as alcoholic steatohepatitis, ASH. This condition, which is sometimes referred to as alcoholic hepatitis, occurs when there is an accumulation of excess fat in the liver, which is accompanied by inflammation. A diagnosis of ASH may be made by a physician if you consume a lot of alcohol, which causes your liver to become inflamed, and you have excess fat in your liver area. It is possible for ASH to result in liver fibrosis if it is not treated adequately. Extreme scarring of the liver, often known as cirrhosis, can result in liver failure. Pregnancy-related acute fatty liver disease, AFLP. It is referred to as acute fatty liver of pregnancy, AFLP, when there is an accumulation of excess fat in the liver during pregnancy. A pregnancy issue that is uncommon but significant is this one. The precise explanation is unknown. Nevertheless, genetics may be a factor in the circumstance. It is common for AFLP to manifest itself during the third trimester of pregnancy when it does develop. When it is not addressed, it poses significant dangers to the health of both the mother and the child. If your doctor determines that you have AFLP, they will strive to deliver your baby as quickly as they possibly can. There is a possibility that you will require follow-up care for a number of days after you have given birth. After having delivery, it is more likely than not that your liver health will return to normal within a few weeks. If you have fatty liver disease, what are the causes of it? One of the symptoms of fatty liver disease is the accumulation of excess fat in the liver cells, where it is deposited. This fat accumulation might be caused by a number of different circumstances. Consuming an excessive amount of alcohol can lead to AFLD. Consuming large amounts of alcohol might cause key metabolic pathways in the liver to be altered. There are certain metabolic products that have the potential to mix with fatty acids, which can result in the creation of different forms of fat that can accumulate in the liver. It is not entirely apparent what causes fatty liver disease in those who do not consume a significant amount of alcohol. With regard to these individuals, it is probable that their bodies either manufacture an excessive amount of fat or do not metabolize fat in an efficient manner. In individuals who do not drink a significant amount of alcohol, but nevertheless develop fatty liver disease, it is possible that one or more of the following factors may play a role. Weight gain. Insulin resistance associated with type 2 diabetes. Chronic metabolic syndrome is characterized by elevated amounts of fat in the blood, particularly triglycerides. The following are some additional possible causes of fatty liver. Adverse effects of several types of medicines that can occur during pregnancy. Some forms of diseases, such as hepatitis C, as well as a few uncommon hereditary disorders. Who are the variables that pose a risk? Heavy alcohol consumption is the primary risk factor for alcoholic fatty liver disease, AFLD. Males who consume 15 or more drinks per week. Women should consume 8 or more drinks each week. Individuals who consume between 40 and 80 grams g of alcohol on a daily basis, as well as females who consume between 20 and 40 g of alcohol on a daily basis, are at an increased risk of developing serious liver disease that is associated with alcohol consumption. A regular drink typically has approximately 14 grams of alcohol, which is a reliable source of information. The following are some additional risk factors for alcohol-related liver disease, AFLD, in addition to heavy alcohol consumption. The genetics of elder age, a history of certain infections, such as hepatitis C, which is associated with obesity and smoking. The following are the primary risk factors for NAFLD. The condition of being overweight or obese, the resistance of insulin, metabolic syndrome, type 2 diabetes, high cholesterol, and excessive triglycerides, among other conditions. Other risk factors for non-alcoholic fatty liver disease include the following. Patients who are older have a history of liver disease in their family and are taking specific drugs, such as methotrexate, Trexol, tamoxifen, Nolvadex, and amiodarone, Paccaroni, are more likely to develop liver disease. If you have a history of certain illnesses, such as hepatitis C or polycystic ovarian syndrome, PCOS, you should avoid getting pregnant. Obstructive sleep apnea, OSA, being exposed to particular poisons, a loss of weight in a hurry. There are a few uncommon hereditary illnesses, such as hypobeta-lipoproteinemia and Wilson disease. It is important to keep in mind that if you have risk factors, you are experiencing a higher likelihood of developing fatty liver disease in comparison to individuals who do not have risk factors. Therefore, this does not necessarily guarantee that you will develop it in the future. Have a conversation with your physician about the various preventative measures you can take if you have one or more risk factors for fatty liver disease. How is the diagnosis of fatty liver made? An examination of your physical condition, a review of your medical history, and the ordering of one or more tests are all necessary steps in the process of diagnosing fatty liver disease. In the event that a physician has a suspicion that you might have fatty liver, they would most likely inquire about the following: the medical history of your family, particularly any examples of liver illness in your family. Your usage of alcohol together with other aspects of your lifestyle. You may have any medical issues, you may be taking any drugs, and you may have just had changes in your health. Notify a medical professional if you have been suffering symptoms that cannot be explained, such as weariness, loss of appetite, or other symptoms. Examination of the body. In order to determine whether or not your liver is inflamed, your physician may palpate or press on your belly. It is possible that they will be able to get a sense of the size of your liver. On the other hand, it is conceivable for your liver to be inflammatory without additionally being larger. By touching your liver, a physician might not be able to determine whether or not it is inflamed. Examinations of the blood. When blood tests reveal increased levels of liver enzymes, fatty liver disease is frequently recognized as the underlying condition. For instance, in order to evaluate the enzymes in your liver, your physician can recommend that you undergo the alanine aminotransferase test, ALT, and the aspartate aminotransferase test, AST. If you have developed signs or symptoms of liver disease, your physician may strongly recommend that you have these tests. Alternatively, your physician may request them as part of normal blood work. Inflammation in the liver can be identified by elevated levels of liver enzymes. It is possible that inflammation of the liver is caused by fatty liver disease. However, this is not the only possible cause. In the event that your test results reveal that your liver enzymes are increased, it is quite probable that your physician will request additional testing in order to determine the reason for the inflammation.